Heart failure is one of the most common, costly, and deadly conditions in modern medicine. More than 64 million people worldwide live with it. 1 in 5 of us will be diagnosed in our lifetime. And despite decades of innovation in cardiac care, heart failure remains a leading cause of hospital admissions, readmissions, and healthcare expenditure, costing an estimated $284 billion globally each year. At the center of this burden is congestion, fluid slowly filling the lungs until every breath becomes an effort. By the time patients reach the emergency department, they're terrified, sitting upright, gasping for air. Most describe the same sensation: "I'm drowning." Increasing pressure within the heart, or cardiac filling pressure, is the earliest warning sign of congestion and the most actionable. But today, clinicians often discover it too late, forced to react to weight gain, symptoms, or vital sign changes that lag behind the true hemodynamic deterioration. By the time weight and vital signs shift, the window for prevention has usually closed. Yet there is a direct and non-invasive way to detect pressure increases in the heart. Cardiac filling pressure assessment has been in the clinical guidelines for decades and is the cornerstone for optimal heart failure management. However, it is just too challenging for doctors to perform consistently. As a result, an incredibly valuable signal has gone largely unused. JVP Clinic changes this. Using sophisticated computer vision, ECG gating, and artificial intelligence, the JVP Clinic transforms a subtle and challenging clinical exam finding into a modern, robust, and quantitative vital sign in less than a minute. No ultrasound, no specialized training, no variability between users, and it works at the bedside, in clinics, in dialysis units, in skilled nursing facilities, and even in the home. In a clinical validation study, JVP Clinic achieved remarkable accuracy, closely matching ultrasound, the established non-invasive gold standard, with 96% of measurements meeting the clinical standard for agreement. This is more than accuracy. It's actionable hemodynamics that finally fit real-world workflows. In the hospital, JVP trends guide IV diuresis, helping teams determine when patients are ready for discharge. In the high-risk 30 days after hospitalization, daily home JVP measurement detects increasing congestion before symptoms develop, enabling proactive medication adjustment and preventing readmissions. And because every measurement is standardized, quantitative, and trendable, the JVP Clinic creates continuity of care across the entire patient journey, from the emergency department to the inpatient ward and back home, that is so desperately needed. The JVP Clinic is more than a device. It addresses a critical gap in heart failure care: early, objective, and non-invasive hemodynamic insights that clinicians trust and patients need. Join us as we work to transform one of the world's most challenging and pervasive diseases. Because heart failure is not only a disease of the elderly. JVP Clinic. Accurate hemodynamics for every patient in every setting.